Oh, hello there. My name is Chris Samsel. You may remember me from such academic materials as Unit 3 reflection paper or Unit 5 PowerPoint presentation. I'm here today to talk to you about Brody. Brody is a 15-year-old high school student who refuses to be told what to do. He's being raised by a single mother who came to me for answers regarding what she so eloquently describes as above and beyond normal teenage disobedience. Brody is a good test taker and his intellectual abilities are above average, but his grades are suffering due to his tendency to become annoyed and pick arguments with the school faculty. Brody's mother assured me he has no history of drug use and has really only been in trouble within the confines of his school, but she worries his argumentative nature will eventually land him in more trouble. Brody seems to be suffering from oppositional defiant disorder, otherwise known as ODD. This disorder tends to cause patients to exhibit behaviors such as losing one's temper, arguing with adults, refusing to comply with the requests of adults on a frequent basis, deliberately annoying others, as well as acting angry, spiteful, touchy, and/or vindictive. ODD is characterized as an externalizing disorder since it involves outward directed behaviors such as aggression, noncompliance, and impulsiveness. ODD is not the end of the world. While there is mixed evidence to support the extent to which genetics and heritability play a part, most professionals tend to agree that environmental factors, such as parenting, academic performance, and peer influence, certainly are involved. It is important to address this behavior early on as to not allow these behaviors to possibly progress into conduct disorder, which typically involves more severe behaviors such as physical cruelty to people or animals, serious rule violations, property destruction, and deceitfulness, often marked by callousness, viciousness, and lack of remorse. There are a few viable treatments available to help treat ODD. Gerald Patterson and colleagues developed a very successful behavioral program called Parent Management Training, otherwise known as PMT, in which parents are taught to modify their responses to their children so that prosocial rather than antisocial behavior is consistently rewarded. I would advise Brody's mother to take actions like bringing Brody out to dinner after doing well on a test, or limiting social media and/or cell phone access after lashing out in school. This is the most effective treatment option available at the moment and condones my full support. Another option we can explore is called multi-systemic treatment, otherwise known as MST. This method adheres to comprehensive therapy that is directed towards Brody as well as his family, peers, and school. This therapy focuses on the contents in which problem behavior arises, consistent interventions, typically on a daily or weekly regimen, and acknowledging Brody's strengths. The final option I have available is a preventative intervention program known as Fast Track. Fast Track is designed to help Brody in school, with his social life, and with his behavior. It focuses on scenarios or environments in which Brody tends to lash out the most. In the end, I believe that one of these methods will not only improve Brody's behavior at school, but also end up helping solidify a healthier relationship between him and his mother. The most important thing to convey to Brody is that he isn't alone in this endeavor. If Brody's mother adheres to one of these programs, I'm sure she will see a change for the better in her son. He may not thank her right now, but he certainly will be appreciative of these efforts and her support down the road. If you have any questions or concerns regarding ODD or conduct disorder that you would like to have answered, feel free to contact my office at 555-637-1985. Again, that number is 555-637-1985. Thanks for watching, and remember, the biggest hurdle between where you are and where you want to be is that first step. Sometimes you just need that little nudge.